This presentation summarises the findings of the JSNA Wakefield Adults Annual Report, focusing on those aged 18 and over living in Wakefield District. The Joint Strategic Needs Assessment, usually shortened to the JSNA, is a continuous process by which local health and wellbeing boards across England assess the current and future health, care and wellbeing needs of the local population to inform decision making. A short video explaining what the JSNA is and how to navigate the website is available on the Welcome to Wakefield JSNA introduction page. Each year, 2 JSNA annual reports, one for adults and one for children, provide an opportunity to focus on the most pressing health needs in Wakefield District. This report summarises the findings where further investigation may be needed. It highlights the local population, district characteristics, health behaviours, population groups, and health protection. A PDF copy of this report is available on the JSNA website for further reading. The PDF copy includes interactive links. Just click on the More Info links to be taken to web pages with more detailed information. Within the report, the comparison is made between the picture in Wakefield and other areas, including national and regional figures. Colour coding is used to show whether Wakefield is worse, in line, or better than the comparator. There are just under 283,000 adults in Wakefield. Over the next decade, the population aged 75 and over is projected to increase to just over 43,000, which shows an ageing population that is also being seen nationally. The proportion of adult population from ethnic minority backgrounds has increased to just over 10% in 2021. People born in Wakefield are not expected to live as long as those born in other parts of the country. Both males and females have lower life expectancy than the England average. Further context for the JSNA annual reports can be found in the State of the District report. This report gives more information about the people and places in Wakefield, including living environment, economy, housing, and education. Housing is widely recognised as a key social determinant of health, and the standard of living conditions can have an effect on health and outcomes for people. The privately rented sector is increasing, as it is regionally and nationally. It's up to 15% from 5% in 2001. And a third of privately rented houses across Yorkshire and Humber are classed as non-decent. There's variation across the district, and although overcrowding levels are low generally, there are pockets where that's higher, around the centre of Wakefield. In Eastmoor, nearly 10% of houses are overcrowded. The next section highlights some of the areas of health that are important to consider in Wakefield District that affect adults. To support the aims of Wakefield Health and Wellbeing Board, to improve the health of the population and to reduce inequality, we asked an independent research agency to conduct a population health survey of adults living in Wakefield District. The full survey report can be found using the More Info button or on the JSNA website. It includes a wide variety of topics affecting adults in the district, and a few measures are shown here. For example, 59% of respondents reported to be in good or very good health, which is lower than the 2021 national census, where over 80% described their health as good. The survey data is fed into lots of analysis and work areas since the survey was carried out. A look into individual JSNA topics, such as the LGBTQ+ population, neurodiversity, and living with obesity, include detailed analysis of the survey data. These can also be found on the JSNA website. Cardiovascular health. Cardiovascular disease has been a significant issue in Wakefield for a while now. The under 75 mortality rate from all cardiovascular disease is higher than the national level and is a lot higher in men than it is in women. Stroke prevalence in Wakefield is also higher than the national level. Diabetes. The percentage of people with type 1 or type 2 diabetes is increasing, both locally and nationally, but it's higher in Wakefield than the national level. Prevalence data for West Yorkshire shows that almost 4 in 10 people with type 2 diabetes live in the most deprived areas of the country, compared to only 1 in 10 living in the least deprived areas. Respiratory health. Wakefield has a higher percentage of people with asthma than that's seen nationally, and under 75 mortality from respiratory disease is also higher than national levels. The prevalence of chronic obstructive pulmonary disease, or COPD, has been decreasing in Wakefield in recent years, however, it still remains higher than the national level. Overweight and obesity. 7 in 10 adults in Wakefield are living with overweight, which includes obesity. And although this is an issue nationally, Wakefield is higher than the national level. Again, the level of obesity is higher in the most deprived areas, and living with obesity can affect other areas of a person's life, such as their mental well-being and sleep quality. Mental health. Mental health is crucial for overall well-being, and good mental health supports a productive daily life and coping with challenges. 1 in 5 adults in Wakefield have a low mental well-being score. Younger adults and those living in more deprived areas were more likely to have a low score. A third of adults in the district said they experienced anxiety, and a quarter experienced depression when asked about long-term conditions in the Adult Population Health Survey. The district mortality rate from suicide is higher than the national level, and Wakefield has the second highest rate of suicide in Yorkshire and the Humber region. Dementia is a syndrome associated with an ongoing decline of brain functioning, which is most likely to affect people in older age groups. 2,800 people aged 65 and over are living with a dementia diagnosis in Wakefield. That's just over 4% of this age group. With an ageing population, it is predicted that there'll be an 80% increase in dementia by 2040. Frailty describes someone's overall resilience. When we lack resilience, we become vulnerable to frailty. Successful condition management, reliable support networks, and a healthy approach to aging can help to improve resilience and prevent frailty. 16,000 people in Wakefield are living with a diagnosis of frailty, ranging from mild to severe. That's around 4.5% of district residents. There's variation in the population. Females are more likely to have moderate and severe frailty compared to males. A higher rate of Asian British residents have mild frailty compared to the district as a whole, and deprived areas have double the rates of frailty compared to affluent areas. Sexual health is a person's physical, emotional, mental, and social well-being in relation to sexuality. Priorities for this area in Wakefield cover a wide scope, including access to condoms for young people, sexual harassment and violence, and advice and support for older people. Chlamydia rates are compared to an aspirational benchmark for detection. An increased rate is indicative of increased control activity. It's important for chlamydia to be treated, as if left untreated, it can lead to longer-term issues, particularly in women. Wakefield was under the benchmark for 2023. Gonorrhea rates have increased locally and nationally since 2020, and it's been one of the main sexual health priorities for the district this year. Risk factors. The next section highlights some of the risk factors that are important to consider in Wakefield District that affect adults. In this case, these are characteristics, conditions, or behaviours that increase the likelihood of getting a disease. Smoking and vaping. Smoking prevalence in the district has declined over the last decade, although it is still high. Around 1 in 8 adults smoke in Wakefield. People in deprived areas of the district are 4 times more likely to smoke than those in more affluent areas. 1 in 8 adults in Wakefield report that they vape. Of those, almost 3/4 said they would like to stop. Alcohol. 3 in 5 adults in Wakefield report that they drink alcohol at least once a week. Of those who drink, around a third were classified as hazardous or harmful drinkers. And alcohol-related mortality in Wakefield has been consistently higher than the national levels over the last 3 years. Drug use. Drug misuse is defined as the use of a substance for a purpose not consistent with legal or medical guidelines. Just under 3,000 people in Wakefield use either opiates and/or crack cocaine. Wakefield has a higher rate of deaths from drug use than both the Yorkshire and Humber region and England national levels in the 3 years from 2021 to 2023. Protective characteristics. Diet, fitness, and sleep are included in this section. Diet and fitness. 7 in 10 adults in Wakefield are physically active, according to the Healthy Lives Survey. However, only half of respondents to the Wakefield Adult Population Health Survey reported doing the recommended weekly amounts of activity. Physical activity can have significant benefits for both physical and mental health. Only 1 in 5 survey respondents said they eat 5 or more portions of fruit or veg a day. However, there are barriers to eating healthy food in Wakefield, with half of those that eat less than 5 a day saying cheaper fruit and veg prices would help them eat more, and a quarter saying that more time to prepare meals would also help. Sleep. 6 in 10 respondents to the Wakefield Population Health Survey reported their overall quality of sleep in the last month as fairly good or very good. A person's sleep and mental health can be closely related. More than 3/4 of respondents who had a low mental well-being score said their sleep quality was fairly bad or very bad. Population groups. Wakefield District includes different population groups. It's important to look at outcomes for these groups in relation to other groups in the general population to identify any inequalities or issues that might affect some people differently to others. Disability. Just under a quarter of adults in Wakefield identified as being disabled in the 2021 national census. Around 1 in 10 people reported to be disabled and limited a lot in their daily lives. Over 2,500 adults in Wakefield have a recorded learning disability in GP practice systems, which is around 0.7% of the Wakefield registered population. Neurodiversity regards differences in brain function and behavioural traits as part of normal variation in the population. It can include autism, ADHD, dyslexia, dyspraxia, and neurodevelopmental conditions. It's estimated between 10 to 20% of the national population may be neurodiverse. Some people need little or no support, whereas others may need more help. It is likely that neurodiversity is underdiagnosed and self-identification is becoming more common as neurodiversity awareness increases. Non-UK born residents. Over 30,000 people who live in Wakefield District were not born in the UK. That's just over 9% of the population. As the population has grown over the last decade, the need for services to support non-UK born communities has also grown. The recent Health Needs Assessment for Wakefield showed that non-UK born communities in the district tend to report positively on their health and well-being. However, some distinct groups seem more able than others to attain better health and well-being. LGBTQ+ is an acronym for lesbian, gay, bi, trans, queer, questioning, and ace. Outcomes for people of the LGBTQ+ population in Wakefield differ to those of the non-LGBTQ+ population across a range of topics. They were less likely to have high mental well-being scores and to say their general health is good, but more likely to have had thoughts about harming themselves. The LGBTQ+ population in the Year 12 school year, aged 16 to 17, were more likely to have been bullied and to feel unsafe in the area they live, at school and at home. Health protection focuses on safeguarding population health against external threats, providing protection and preventative care. Cancer screening. Screening and immunisation programmes are an important part of preventing ill health, identifying conditions early, and enabling timely treatment. Bowel and cervical cancer screening coverage in Wakefield is higher than national levels. Nationally, breast cancer screening levels dropped in 2021 during the COVID-19 pandemic from over 70% and have remained at a similar level. Recent data shows that breast cancer screening coverage in Wakefield dropped below the national level in 2023. Vaccination coverage. Vaccinations are critical to help protect against potentially life-threatening diseases. With the exception of shingles in the older population, which is lower than the England level, vaccination coverage across Wakefield district is generally similar to or above the national level for adult vaccinations. However, some population groups have lower coverage levels than others. That concludes the summary of the Adults JSNA annual report. Thank you for listening.